Hi everyone, this is Aurelie Najm in live from day 3 of EULAR. So far, amazing content, amazing crowd, lots of people everywhere, really nice poster sessions, really enjoyable. One of the presentations this morning that caught my attention was OP0267. So it's actually looking at the assessment of cardiovascular risk in inflammatory arthritis. We know, and it's been, put down in recommendation, in the EULAR recommendation for management of the comorbidities of the patients, we do need to assess cardiovascular risk. And a lot of us considered, this is partly a responsibility to take care of that. And also the other thing is because the cardiovascular risk scores have been developed in general population and not in arthritic people, it was recommended that maybe the coefficient would be applied. So if you find a score, you need to multiply by 1.5, so it's more representative of your of arthritic people. However, it's really unclear what score to use, and there are actually several. And so this study was looking at that. How do each of these scores perform when it comes to predicting cardiovascular events in a population of people living with arthritis? So they looked at different types of inflammatory arthritis, and they had massive amount of patients. So this is database study. So it was looking at above 30,000 axial spondyloarthritis, above 25,000 PSA people, above 80,000 RA patients, and over 1 million controls. And they did something interesting. The controls they used were not healthy population. There was also a population that had a restriction in their physical activity because of joint pain without inflammation, and therefore they choose osteoarthritis. So very large database study. One of the pitfalls, and I'm telling you this straight away, is that they did not have this data. They had only cardiovascular events. But anyway, I think moving on to the results, they look into 3 different scores. The first one is Q-risk-3, Framingham, and the Reynolds risk score. So what they see, and I think it's really interesting, is that unfortunately, none of this score is very accurate to predict cardiovascular event in all the population, including osteoarthritis. And I was a bit surprised by this result, but I think it hasn't been looked at before. So it was really interesting. The other thing is that it seems that, some of the score mainly underestimate the risk of cardiovascular events in the populations. However, the Q-risk-3, in fact, could be overestimating the risk in certain population, including ankylosing spondylitis. And therefore, maybe the coefficient of 1.5 I was talking about earlier is not really applicable to this specific group. When it comes to the Framingham tool, it looked actually that the prediction was more accurate in ankylosing spondylitis people than the other group. So I think this is something to take into account maybe as well. But I think most importantly, it highlights the facts that we do need maybe a score, a cardiovascular risk score that would be dedicated to people with arthritis and in fact to people that have a restriction in their physical activity. So maybe this is something to focus on in future research. Well, I was delighted to share of this with you, and go online and ramnow.com for more content and follow me on Twitter at Aurelie Najm.